what I'm going to do is show you how you go about building up the picture. We think in very pictorial terms in homeopathy. We talk about the symptom picture, the person picture, the medicine picture. As opposed to in conventional medicine, it's eczema. Right, the first line treatment for eczema is emollients, bland treatment. Second line treatment is weak steroids. Third line treatment is moderately strong steroids. Fourth line treatment is stronger steroids, and then there's tacrolimus and so on, so on, so on. So it's a stepwise. With homeopathy, it's not like that. It's a matter of, okay, this is eczema. And as I've said, it is important to make the diagnosis. It is important to be sure that this is eczema and not something that homeopathy is not an appropriate treatment for. But it is, so it's eczema. Well, what is the picture? So first of all, what we call the locals, the things that affect, that are local to the disease. What is it like? Is this an intensely itchy rash? Where, or does it crack? Does it exude? Is it pimply? Is it blistery? Where is it? And particularly the pattern. Is it flexor, so meaning in the veins, in the ears, or particular locations? In the ears, on the nipples, genitalia, soles of the feet, palms of the hands, any particular locations. And what's the pattern? Does it come in sort of rounded little patches, or is it in big areas? Does it ooze easily? Does it flake a lot? That sort of thing. What is the pattern? What exactly is the pattern? And it varies remarkably within what is normally a single disease. And then the pace and the pattern of evolution, as I mentioned earlier, the pace can be important. Apis, is for rapid evolution. Precipitating factors, allergens, and so on. And then one of the satisfying things about doing homeopathy is that many people with many kinds of skin disease or of disease of any kind will relate its onset to a particular life event. An acute shock. Actually, apis in our books, the old books, has an indication jilted at the altar. I don't think that happens anymore. It's probably more like came home and found her husband in bed with another woman, but some kind of acute mental shock. Actually, what is much more common is chronic mental stress, and causticum, that was mentioned earlier, is one of the ones that sometimes they will tell you often a harrowing story of chronic mental stress of looking after an aged parent who eventually died. And they're all right as long as the stress is on. When the stress is off, they suddenly get ill. Other illnesses, anything that seems to trigger it off. And then anything which makes it better or worse, this sign is not a greater than sign for us. It means it's better from or worse from. Season, we talked about local temperature, local applications, anything at all that seems to make it, that the patient observes to make it better or worse. And then the person, not the disease. What kind of person is this? And you can just ask I always do, start with an open-ended question. How would you describe yourself as a person? Which people hate answering. But their answers to that can be very revealing. And sometimes it's not what they say, but how they say it. It can be very revealing. Are they anxious, depressed, irritable, an extrovert or an introvert, tired or untired, assertive or yielding? Fears and phobias, memory and concentration, all these things if they don't volunteer, you would need to go through systematically. And then what we call the physical generals. You don't need me to tell you that some people feel the cold more than others. Some people are owls, some people are larks, some people are good at getting up in the mornings, some people hate the mornings and are much better late at night. People have varying sleep patterns. Just to show you how we put these things together, I'm going to talk about 3 homeopathic medicines, which in my experience cover maybe 60% of cases of eczema. And it's a sort of compare and contrast exercise to show how you fit it together, how you build up the picture and differentiate one homeopathic medicine from another. The distribution tends to be non-flexor, in other words, not particularly in the veins. Eczema typically is flexor, it tends to be in the veins, so if it's not, that is particularly interesting. It's often in small round patches, dry, very, very flaky, itchy, very itchy, and burns after scratching. It's worse in cold weather, worse in winter. And rather unusually, the heat relieves the itching. Actually, you usually see the opposite. So heat, itching relieved by heat is quite interesting because it's unusual, because it's anomalous. And what often gives it to you is, they are terrible worried. They're very anxious. If it's a woman, they come in. You think of this typical lady with a coiffure that is just too perfect, not a hair out of place. Immaculately dressed and just sitting there, you can almost feel the tension. Or if it's a man, smartly dressed, but the tie not just that little bit too tight. So tidy, fastidious, proud, obsessional. And one of the things I ask them is, if they're coming, they come to the appointment by train, and the train will say, do they get into a terrible state? Their plans, they're really thrown by anything going wrong. They're chilly, they feel the cold a lot. They're very restless. When they're unwell, they're very restless. They can't rest. And they're very often worse, perhaps not so much with eczema, but certainly with asthma. If these people have asthma, they get their attack at midnight or 1 a.m. Here, the flexor district, you have a flexor district. It is in the folds and the bends. And particularly, one of the very characteristic things is just behind the ears. And they often get it either in the ears, otitis externa, which is really maddening, itching right inside the ears, or cracking behind or under the ears. I remember one girl I saw who said, oh, when my eczema is really bad, it feels like my ears are going to fall off. She got such deep cracks there. And nipples, it affects particularly the nipples, genitalia and other places. And a lot of cracking. It will crack, whenever it's bad, it will get cracked behind the ears, but on the fingers, everywhere. There's a lot of cracking, and it oozes when it's bad. If they scratch it, it goes sticky and oozy, very characteristic. And often they get ridging of the nails, particularly crossways ridging of the nails. Worse before the periods in a woman, very often. And sometimes, you get a feel of these people. They're a bit stodgy. They won't give you a straight answer to anything. They can't make up their mind about anything. It can be a bit frustrating. I remember saying, I had a young woman recently. I said to her, "Are you indecisive? Can you make up your mind?" So she thought for a moment, then turned to her husband who came with her and said, "Can I?" So that's what you call not what they say, but how they say it. And actually a very characteristic thing is weepy, but particularly sentimental weeping. They'll tell you they get weepy over stupid soppy films on the telly. They know it's stupid, they know it's soppy, and yet they get weepy. Or over sad music. They can get that sort of thing makes them weepy. And they tend to be shit. So the local symptoms, again, the distribution tends to be extensive, not so much in flexor. And very often they have hot feet. These people will tell you that they stick their feet out of bed at night, or they kick. The first thing they do when they come in from work is to kick off their shoes. Very itchy, voluptuous. They enjoy scratching. It feels good to scratch. And often when you look at them, you'll see they have large excoriated patches. You can imagine them sitting at their desk at work, and you can see it. You can see that they enjoy scratching. They hate heat. Heat makes it much worse, and for the same reason, they're worse in bed at night. They're assertive, they're argumentative, and very often you can spot them as they come through the door. They're untidy, scruffy, or sometimes flamboyantly dressed. This is the rather large lady in a purple dress. But they're often quite entertaining patients. They're cheerful, they're extroverted, slightly larger than life characters, and they're actually sometimes quite amusing patients. You sometimes spot them through the door as they come through the door because they walk in the middle of winter in shirt sleeves and proceed to sit down and tell you their life history and their opinions about what a scandal the government is and so on. And you just sit there because you know what you're going to give them anyway. They'll give you quite an entertaining chat. They're hot. They never feel the cold. They're worse than the heat, and they like spicy and fatty food. And my image of these people is their favourite occupation is going down to a local Indian restaurant, having a really hot curry, washed down with several pints of beer, and a really good argument with their mates about sport or politics or whatever. I think we all know a few people like that. These are the world's politicians and trades unionists, while the arsenicums are the world's accountants and pharmacists. And we all need them, and these things have, can be adaptive or maladaptive. We do need obsessional people to be our accountants and our pharmacists. We need garrulous people to be our politicians and our trade unionists.